a beautiful time with the weather we have right now. It's kind of cold, you know, it's very cool. But again, it comes with a lot. For us, a lot of people say it's called the August break, a time when the rains reduce and you see a lot of, in the evening and in the morning, early morning, you see it's very cold, as in like, as if it's like a Harmattan period. But again, our concern for us on Health Watch is how do you protect yourself during this cold weather? And we're able to interview a nursing officer with the Federal Medical Center, and she talked about how to take care of yourself so you don't come down with cold, cough and catarrh. Plus, we do a recap of the interview we had with Dr. Chinemere Okudo. He was able to identify what an asthmatic patient should be doing at this point. All right, we know that some asthmatic patients are allergic to cold, especially this weather. So how do you take care of yourself so you ensure that you don't have a crisis, and when you have a crisis, you know how to protect yourself? My name is Nkem Okibe. I love to do this with you every week. We're going to short break. When we return, first on our lineup as the special report on how to protect yourself during this weather. Stay with us. Health Watch continues in a moment. The rainy season in Nigeria typically occurs between April and October. During this period, the skies are mostly cloudy and we get lots of rainfall with a breath of freshness and coolness of the weather, which is a relief from the scorching heat. However, in recent times, Lagosians have observed a noticeable change in the usual pattern of rainfall. Instead of the frequent heavy showers expected this time of the year, there has been a reduction in rainfall, replaced with a lot of cold, particularly in the early mornings and late evenings. While this coolness is a welcome change for many, it also poses some health concerns such as cough, catarrh, flu, chest congestion, and the likes. How do you protect yourself this period?
So during this cold weather, especially in children, warm water is very important to bathe them in the morning. Then these thick clothes, you know, you dress them according to the weather. So they have to wear cotton inside, then they wear their pullover on top. Then those that are sensitive to cold weather, then the use of face masks, very important because of this weather, the environment we are in now. There's no just special food like that, but let your food be warm. Let it be warm during this season. Avoid cold drinks. Cold drinks is not good. It's not advisable during this season, during this weather. Then the intake of fruits, especially oranges, citrus fruits, that has vitamin C, increase intake of vitamin C, then steam inhalation, bathing of warm water. That is what we can do so that we prevent all these respiratory tract infections.
With these simple tips, you'll be able to cope with the cold weather. It is recommended you seek medical attention whenever you experience persistent symptoms. Stay warm and stay healthy. Thank you so much. That's coming from Nurse Ota Okaha. And for me, I feel like one of the things that we must always have in mind is that your health is your priority. You don't need someone to keep teaching you all the time. You need to be able to be intentional about taking care of yourself. So in the evening, early in the morning, you need to really protect yourself by wearing, cover up your body. And if for any reason you come down with cold, flu or catarrh, ensure you see a medical practitioner for the next thing to do. All right, moving on, we have a recap on asthma. What are the triggers of asthma? How do you ensure that you have a loved one who is asthmatic? How do you take care of the person? How do you step in with that first aid, tips on how to manage that person, especially during this period? Let's take a look at this interview. We'll be right back. Stay with us. Our guest in the house today is Chinemerem Okudo. He is a general practitioner. You're welcome to Healthwood.
Thank you so much, ma'am. Nice to be here.
Okay, we talked about asthma at the intro, and one of the things I found out about asthma is that as long as we refuse or we shy away from talking about asthma, a lot of people are dying from asthma.
Yeah.
All right, it's not like the very obvious cancer or liver related or kidney related issues. For asthma, I feel like there's a low awareness on it. People do not really talk about it. So first, what is asthma and what's the difference between asthma and ordinary breathing difficulties?
Well, asthma is basically a hyperinflammatory condition. What does that mean? Let me try to break it down without having to speak too much jargons. Okay, so imagine a tree with its branches, okay, but it's inverted, right? Now that tree is the trachea and the bronchioles. So this is the back of the trunk of a tree with its branches. So when the back is kind of tightened because of some sensitivity or maybe some exposure, that is what triggers the asthma, right? So the bronchioles, which is the branches, or the trunk itself, that's the trachea, can become inflamed, that's swollen, right, due to those exposures, and they become causing maybe blockage and difficulty in breathing, right, or maybe persistent coughing in those people, right? So we're talking about the comparison between that and ordinary breathing difficulties. I think their differences are from, let's say, what causes it. Okay, the causes of ordinary breathing difficulties in you and I, or the normal person, is most times is from maybe running too much, like exertion that when you run too much, or maybe in some people when they're just having, like, you say, cough or chest infection, they might have breathing difficulty. Of course, when it's that one, you can know, with relaxing, sitting down, being calm, you can be okay, right? Or maybe taking medications like your antibiotics. If it's infection, chest infection, you'll be fine. But in their own case, even more than that, something as little as AC, right, being exposed to cold, something as little as dust, something as little as smoke can trigger them. In addition to exertion too, do you understand? In addition to recovering from infections, any stress conditions, even in pregnancy in some people, right? Those things can trigger asthma, and those are like the key differences you can see in both of them.
So what are the factors that trigger asthma crisis in a person, or what are the factors that exposes one, to being asthmatic? Is there something like that?
Okay, yeah, okay. So the major factors are they are majorly under. First of all, the person has to have had a family history. Okay, a family history.
So you're saying it's hereditary. It must run in that family lineage.
Yes, somewhere in that. But there's a factor of that. Okay, there's a factor of that. There's a factor of childhood exposure. Okay, some people, their environment in their childhood. There's this theory of people that if you don't expose your child to some allergens when they're younger, when they're older, they tend to have asthma.
They don't adjust to the environment.
Exactly. So if when the child is small, you tend to like put the baby in a bubble bath, like kind of like in a bubble, like, oh, I don't want my child to go and play outside. I don't want my child to touch the ground. I want to wear them socks and everything. So those things, those protection.
You don't allow the child to experience
exactly.
The real African play. You play with sand. You play with different things.
So those things would in the future predispose the child to being triggered easily than his counterpart, his or her counterpart. Do you understand?
That's been exposed to all of that.
Exactly. So there's family history and there's that environmental. Then other things like the triggers can also cause it. Yeah, that I mentioned earlier.
So I was going to talk about something that happened. I was a boarder while growing up, and I realized that one of the ways to dodge some of those boarding school duties is to say, I'm asthmatic. So then back in the days in school, everybody used to claim I'm asthmatic, I'm asthmatic. So I was like, is this part of, is it a lifestyle?
Even at home.
You know, is it something that everybody should be proud of? Is it something that you should have? And my story is going towards the fact that there was this girl. She was not asthmatic at the time, but she had just been treated with malaria, and she started witnessing shortness of breath. She finding it difficult, you know, to do a lot of things that she used to do before. And all of a sudden, she went to the school clinic and she was declared, oh, you are asthmatic. I'm sure you didn't know this before now. So it's important that we highlight what are the signs and symptoms to look out for. Because one of the things that I remember was that she said her chest used to make sounds. And for us, it was even scary. We actually thought it was something spiritual, you know. Yeah. So it's good that this kind of program is also creating awareness to people, you know, for everyone out there, you know, both young and old, especially for children, you know. So what are the signs and symptoms to look out for?
Yeah. What you said just brought something to my mind. It's something that is very important, especially for school age children, to actually be more aware of asthma, right? To help them be more empathetic towards their classmates that have asthma. Because further that when children have asthma, when they're wheezing, they try like laugh at them. When you see them with their inhaler, they stigmatize them. So things like that. It happens in schools a lot, right? It happened in my secondary school. I wasn't asthmatic, but I know it happened. Like I see them, people do that. I didn't know much about asthma then, right? But I just know this person had a serious condition that was scary. I mean, the sound's always scary when you're beside someone whistling, but that's what it's called, wheezing. That's sound that they make. Okay, so they could be whistling sounds. Okay, so that whistling sound is like when they are breathing out. You be hearing this. That's what you're hearing when they're breathing out. Okay, and they find it difficult to breathe in. Okay. Right. So imagine you can't breathe in properly. You can't take it there properly. And when you want to release the one that is in your chest, it's passing through a very tight way. So meaning that there's air in your chest, but you can't take it out. So you can't take it in. When you take it in, you can't take it out. So that's the issue they're having. Okay. But more on the taking of out. So when you have more difficulty taking it out, that sound, because it's going to a small pipe as the usual normal size. So you have this whistling sound coming out. Okay. Some of them can have, because one thing about asthma is this. It doesn't just come. Okay. Like it doesn't just happen.
There must be a history.
Exactly. So if it's going to come tomorrow or next tomorrow, you could start seeing some signs here and there. Some people don't think much about it. Some people don't think much about it. So signs like chest tightness. So it's having this kind of, as if there's like a band on their chest. There's this tightness on their chest, right? They probably say, I don't know, maybe it's my tight clothing. Maybe it's what I'm wearing on my chest. Maybe that's what. Okay. Some people start saying, oh, that they see that, oh, they cough a lot. Okay. They see that they cough a lot, and they wonder, maybe is it because I was exposed to cold water, or you say, I'm just coughing. I don't know. Maybe it's cold water. Maybe it's what I ate that was fried or something, which is a myth, by the way. Fried things doesn't cause asthma. Right? So those things are. So you can notice chest tightness. You can notice coughing that is not productive. When I mean not productive, I mean that nothing's coming out. Just be coughing, but there's nothing coming out of it.
And it's not dry.
It's just the dry cough. Just nothing. Just
and there's no sputum.
No sputum.
Okay.
No sputum. Okay. Then the whistling sound. Okay. Those are the three major things you might notice in the person. Okay.
Let's talk about the fact that some asthmatic patients might not really need inhalers. Some of them might just need to go to the hospital and use nebulizers. I don't know what's the difference between the two. So you see some that always have it in their bags. It could be triggered at any time. And some could stay for years, no crisis. Yes. And when it comes, probably they are just recovering from an illness, or they travel to a different environment. So like you go to Canada, all right? So you just see that you're already, you're not getting used to the environment. So you're having this crisis all the time. So what's the difference between using an inhaler and a nebulizer? At what point should an asthmatic patient always be with his or her inhaler?
Okay. Thank you for that question. There's no particular point. Once you're diagnosed as an asthmatic, you should have your inhaler. You should. Okay? You should always have your inhaler with you. You shouldn't say, okay, mine is not that severe. I mean, I shouldn't have to take it everywhere. You don't know when the crisis is going to happen. Okay. You might be there are some things that you can see here and there that can help you. So I might be having a crisis soon, like I mentioned earlier. You see those persistent coughing, maybe those kind of chest tightness, maybe some weaknesses. You can notice, oh, maybe this always happens around, right? So you can, or maybe you're in travel to Canada, you own, like an example. So when you travel to Canada, of course, the temperature here and there is very different. So their climate is way different from ours.
Yeah.
So you notice that the amount of time you're exposed to cold over there is going to be way different and more severe than Nigeria, right? So you should, those things, those situations to make you understand, oh, you should have your inhaler. But that doesn't mean that you should keep them or say, oh no, I don't have, mine is mild and everything. Always have your inhaler. For nebulizers, right? When you're in your home, in comfort of your home, it's always better to use your nebulizer. It's better when you have it like, it's always better that way, okay? Because nebulizer help the component of your inhaler to get inside easier and better. Okay, that's why I say when you're in your home, you can use a nebulizer, right? But yeah, the inhaler is supposed to be in pocket when you go outside, and it's always better to use an inhaler with a spacer. There's something called a spacer, right? It's like a longer tube, right, attached to the inhaler. It's to help the particles spread out easy, right? When you take an inhaler. Okay. Yeah.
So the big question: can asthma be cured, and how would asthmatic patients stay healthy?
As a medical practitioner, medicine right now, currently, asthma cannot be permanently cured. Okay, of course, I am a Christian too, right? And I believe in miracles. Yeah. Well, medically, asthma, as of now, cannot be permanently cured. However, that doesn't mean that you can't have a full life. That doesn't mean you can't enjoy life to the fullest, right? I hear people say, "Oh, I'm asthmatic. My son is asthmatic. He shouldn't play ball. My son is asthmatic. My daughter is asthmatic. She shouldn't do that." You can do exercises, right? There are a lot of asthmatic athletes. So you just have to be conscious of your condition. You have to be aware. You have to have your inhalers. You have to be up and doing with your regular appointments with your doctors. That's what I'm saying to put. So you have to be going for regular appointments. You have to have your medications. You have to know what your triggers are. I think with those things, you're able to manage, because it's chronic. It's chronic, right? But you'll be able to manage. It's highly controlled. Highly controlled. Yeah.
Very good. It's so reassuring to know that it can be managed. And I like the last word, know your triggers. I have a friend that cannot stand perfumes.
Exactly.
Even the mildest of perfume, she's telling you, "Hey, I'm choking, I'm faint."
And it will be confusing. But to her, it's actually choking, right? Every other person will be like, no, I don't understand. This is not harsh enough. But to her, yes, it is. All right. So it's left for that person to just know, oh, when this is her own trigger, she doesn't stay around those things. Just avoid it. Just avoid it as much as possible. People have different triggers and different severity of those triggers to themselves.
I like you also debunked the myth around fried things, because I used to ask myself, fried things, fried chicken, fried chicken, excuse me, fried meat, fried fish.
There's a lot.
How am I supposed to do that? All right, so I'm like, someone that is asthmatic and you see fried chicken, fried fish, are you going to say, this is a trigger?
There's a lot of those myths going around. I don't know. I mean, mine is not asthma, right? But I actually had skin reactions when I was growing up. It was really bad. I had to wear long sleeves going to school. Yeah, people said this boy likes to dress with sweaters and everything, but I was trying to hide my reaction. I had to figure out myself. I had to like take a diary. Yeah, that's important. Yeah, I just remember now. So if you're asthmatic, please have a diary. Okay. Know your triggers, noting them down. Right. So you know that 1, 2, 3, 4 are the major triggers that I have. So whenever you have those like the red lines, you don't expose yourself to them. You don't try to expose yourself to them. So I had to like have a diary to note, oh, is it this? Whenever I noticed what happened to me, what's the situation around it, and I figured out that, lo and behold, mine is mosquito bites.
Oh, okay.
And I had rashes all over because of mosquito bite. Yeah. Very severe rashes.
Because you were reacting to them.
Yeah, it's mosquito bites.
So very quickly, final question. Yeah. What should family members, bystanders, friends, what should they do when you see someone going through having an asthma crisis? What are you supposed to do?
Okay. As a bystander, as a family member,
as a friend, as a colleague, classmate,
whoever you are, whenever you see someone with asthmatic crisis, I think it's very important. And the first or foremost important thing you should do is to calm them down. Try to like calm them, because even someone that is well knowledgeable about his or her condition, knows their triggers, in a crisis, they can start panicking. Like, it's that severe. You know, the airway is very important. Not being able to breathe in and breathe out is very bad. Like, can be very bad. That person can start panicking, and panicking doesn't make it better. It makes it worse, right? So, as the best, I try to make them feel calm, right? And that is where prayers. When I see people pray, as I have no issue people praying, right? Regarding asthma and all this, because prayer to some people is like, gives them reassurance. It calms them, it makes them feel better.
True.
Right?
True.
So if you want to pray, maybe you are praying for the person, and the person hears you praying, maybe makes the person feel better. Right? If the person is lying down, try to sit them up. Okay, let them sit up so that they can use their respiratory muscles, can use their chest to breathe. Okay, so sit them up, calm them down. Like I said, when they're in an asthmatic crisis, their chest feels like it's tightened. Right? So anything that they're wearing that feels tight, their clothes, ties, collar, whatever. If it's tight, just unbutton, right? Remove the clothes if it's tight clothes. Then they should have, or I'm assuming at this point, they should have their own inhalers. Okay, seek for the inhalers. Yes, I forgot to mention. There are two types of inhalers. There's a preventive and there's rescue inhaler. Okay, so when someone is in an asthmatic crisis, if someone is in crisis, you're supposed to use the rescue inhaler, not the preventive. Okay, the preventive inhalers are the ones they take daily to prevent the crisis from happening. Okay. But when the crisis happens, they use the blue one, that's the rescue. Okay. Okay, so when the person has the crisis in front of you, the one you're supposed to use is the rescue inhaler. Okay. Okay, so you take one puff for 1 minute, right? Then you keep observing them. Then repeat it. Okay, you can take up to 8 to 10 puffs. Okay. But one puff for 1 minute.
Interval of 1 minute.
Interval of 1 minute, exactly. So you can take up to 8 to 10. Now, at that point, they should be feeling better. But if they don't, right, you start notice that, oh, you're not feeling better at the 5th, 6th, 7th puff, 8th puff, you're not feeling better. You can go to maximum to 10. Don't go beyond 10. But at 8th puff, they should be feeling better. If they're not feeling better, then you have to call for
seek medical attention.
Yes, or get them to the hospital as soon as possible. If you notice that they are, for some reason, it's becoming worse, they are struggling to breathe, or you start noticing something they call skin tugging at the throat here, alright? So you start noticing that this place is going inward, right? Because they're trying to breathe, so it's going inward. Then you just have to take them to the hospital.
Wow. Thank you so much, Chinemere Okudo, for coming on the program.
You're very welcome.
And that's the much we can take on this week's edition of Health Watch. Remember that I normally say health conscious people live longer. You love to see my face, you love what we do on this show, then you want to sponsor this program, reach out to us on 0706086547 or send a mail to okibenkem@gmail.com. You missed any of our episodes, you missed our live streams, please follow us on Facebook, NTA Lagos Channel 10, or on YouTube, NTA Lagos Channel 10. A big shout out to my production crew. I'm smiling because I'm seeing them behind the camera. And of course, to my director, Mr. Ekini Bosun, and the engineering crew. Thank you so much for ensuring that every week will come up on the show and we'll have a smooth production. My name is Nkem Okibe. Join us same time, same station. See you next week. Bye.